Healthcare-associated infections, or HAIs, are a concern for patients and healthcare providers alike. Catheter-associated urinary tract infections, or CAUTIs, are among the most common HAIs. According to data published by the U.S. Department of Health and Human Services, CAUTIs are associated with increased morbidity, mortality, length of stay, antibiotic use, and costs of more than $500 million annually. Aseptic procedures and proper catheter maintenance play an important role in helping mitigate the risk of CAUTI. This instructional video will provide a step-by-step demonstration of aseptic technique used to catheterize male and female patients with the Bard Advanced Foley tray system. This will be followed with a description of some important techniques related to ongoing Foley catheter care, maintenance, and urine sample collection. The Bard Advanced Foley tray system is designed to follow the CDC guidelines for prevention of catheter-associated urinary tract infections. A Foley catheter should be placed only when necessary and discontinued when it is no longer required. Prior to placing the Foley catheter, obtain a physician order and confirm the patient meets appropriate indications per CDC guidelines or hospital policy for indwelling urethral catheter use. Choose the Foley catheter tray which best meets the needs of the patient. Use the smallest Foley catheter possible that provides good drainage. If the close monitoring of urine output is required, select a pre-connected, closed-system urine meter tray. Likewise, if the patient requires continuous temperature monitoring, a temperature monitoring Foley catheter system may be selected. Catheterization should always be preceded by an explanation to the patient. A patient family education card is provided underneath the tray to inform the catheterized patient on what it means to have a Foley and how they can properly care for or maintain their Foley to help prevent CAUTIs. Ensure the patient's privacy by closing the door to the room and/or drawing the curtain. The first step required in any invasive procedure is an antiseptic hand wash. Hand antisepsis compliance is a simple yet critical defense measure that protects both the patient and the caregiver. Don clean gloves in preparation for pre-cleansing of the perineal area. Ensure adequate lighting. Arrange for extra nursing personnel to assist as necessary. Position the patient supine with the knees flexed and separated. Open outer packaging of the Foley catheter tray. Remove the directions for use brochure from the bottom of the tray, label and orange sticker sheet from on top of the tray, and set aside. Place the Foley catheter tray between the patient's legs. Using proper aseptic technique, open outer wrapping, opening the first fold away from you. Remove the underpad found beneath the third fold of the wrap and place it underneath the patient, plastic or shiny side down. Open the packet of Castile soap wipes. Remove and unfold all 3 wipes. Cleanse the penis and periurethral area, discarding each wipe after use. Advance the tray and wrap toward the patient. Remove and discard your soiled gloves. Perform hand hygiene with the provided alcohol hand sanitizer gel. Open the final fold of the wrap. Don the sterile gloves while maintaining sterile technique in an area outside of the wrap. Position the fenestrated drape over the external genitalia so only the penis is exposed. Use caution not to contaminate your sterile gloves. Locate the green syringe with lubricant and deposit the full amount of lubricant into the tray. If hospital policy permits injecting lubricant into the male urethra, full amount will not be dispensed at this time. Open the packet of pre-saturated povidone iodine swab sticks. Remove the top tray and place it next to the bottom tray, keeping both on the outer wrap. Attach the syringe filled with sterile water to the inflation port. Please note that it is not necessary to pre-test the Foley catheter balloon. Remove Foley catheter from the blue wrap and place it in the lubricant. When you are ready to begin prepping, elevate the penis with non-dominant hand, holding it perpendicular to the body without compressing the urethra. This hand is now contaminated and committed to non-sterile activity. With the uncircumcised patient, the foreskin should be gently retracted. With the pre-saturated povidone iodine swab sticks, cleanse the penis in a circular motion, starting at the urethral meatus and working outward. Use all 3 pre-saturated swab sticks. If hospital policy permits, or following physician's orders, inject remaining lubricant into the urethra per established protocol. Remove the catheter from the lubricant. Insert the Foley catheter into the urethral meatus, using gentle downward pressure. Insertion may be eased by instructing the patient to take deep breaths and exhale slowly. If using a coude catheter, insert the catheter tip into the meatus with the curve facing towards the ceiling. If during insertion there is an obstruction or difficulty, stop. Do not force passage. Call for appropriate assistance or follow proper hospital policy. When the catheter tip has entered the bladder, urine will be visible in the drainage tube. Advance the Foley to the bifurcation of the catheter or as far as hospital policy permits to assure the balloon is within the bladder. Inflate the catheter balloon with the entire 10 milliliters of sterile water provided in the syringe. Only sterile water must be used to inflate the balloon. Remove syringe. Once the balloon is inflated, gently pull the catheter caudally until the inflated balloon is snug against the bladder neck. If successful catheter insertion is not completed, including breaks in aseptic technique, replace the catheter and collecting system using aseptic technique and sterile equipment. If proper catheterization is not accomplished, use a new catheter system. After inserting the catheter, discard all materials in accordance with hospital policy and remove contaminated gloves. After thoroughly washing hands, don clean gloves in preparation for pre-cleansing of the perineal area. Ensure adequate lighting. Arrange for extra nursing personnel to assist as necessary. The female patient is best catheterized in the dorsal recumbent position. An alternate position for the female patient is side-lying Sims. The knees must be adequately separated to obtain a clear view of the periurethral area. Open outer packaging of the Foley catheter tray. Remove the directions for use brochure from the bottom of the tray, label and orange sticker sheet from on top of the tray, and set aside. Place the Foley catheter tray between the patient's legs. Using proper aseptic technique, open outer wrapping, opening the first fold away from you. Remove the under pad found beneath the third fold of the wrap and place it underneath the patient, plastic or shiny side down. Open the packet of Castile soap wipes. Remove and unfold all 3 wipes to cleanse periurethral area. Use each wipe once in a top to bottom motion. Advance the tray and wrap toward the patient. Remove and discard your soiled gloves. Perform hand hygiene with the provided alcohol hand sanitizer gel. Open the final fold of the wrap. Don the sterile gloves while maintaining sterile technique in an area outside of the outer wrap. Position the fenestrated drape over the perineum, exposing the urethral meatus. Use caution not to contaminate your sterile gloves. Locate the green syringe with lubricant and deposit the lubricant into the tray top. Open the packet of pre-saturated povidone iodine swab sticks. Remove the top tray and place it next to the bottom tray, keeping both on the wrap. Attach the syringe filled with sterile water to the inflation port. Please note that it is not necessary to pre-test the Foley catheter balloon. Remove Foley catheter from the blue wrap and place it in the lubricant. Using the pre-saturated antiseptic swab sticks, prepare the patient. With your non-dominant hand, carefully retract the labia to fully expose the urethral meatus. This hand is now contaminated and committed to non-sterile activity. Each swab stick will be used for one swipe only. Use the first swab stick to cleanse the labia minora furthest from you with a downward stroke and discard. Do the same with the labia minora closest to you. With the last swab stick, cleanse the middle area between the labia minora. remove the catheter from the lubricant. Insert the catheter into the urethral meatus, using gentle pressure until urine is seen in the drainage tube. After urine has begun to drain, advance the catheter 2 more inches, or around 5 centimeters, and inflate the catheter balloon with the entire 10 milliliters of sterile water provided in the syringe. Only sterile water should be used to inflate the balloon. Remove syringe. When inflating the balloon, observe the patient. If the patient complains about pressure, stop immediately. Deflate the balloon, gently advance the catheter, and inflate it again. Once the balloon is inflated, gently pull the catheter until the inflated balloon is snug against the bladder neck. If successful catheter insertion is not completed, including breaks in aseptic technique, replace the catheter and collecting system using aseptic technique and sterile equipment. If proper catheterization is not accomplished, use a new catheter system. After inserting the catheter, discard all materials in accordance with hospital policy and remove contaminated gloves. Hang the drainage bag near the foot of the bed. The bag should always be positioned below the patient's bladder. The bag and tubing should never touch the floor. Ensure the drainage bag is completely unfolded. If a urine meter bag is used, you should exercise the spine of the bag. Arrange the tubing to ensure proper flow of urine into the drainage bag. Utilize the green sheeting clip to secure drainage tube to the sheet and avoid dependent loops. Maintain unobstructed urine flow and keep the catheter and collection tube free from kinking and dependent loops. Secure the catheter to the patient's thigh using the StatLock Foley stabilization device located in a bag hanging from the drainage hanger, or with the device currently being utilized at your facility. Proper use of the StatLock stabilization device will be discussed at the end of this video. Complete the orange stickers that were set aside earlier in order to document the procedure according to hospital policy. It is recommended to maintain a closed drainage system whenever possible by utilizing pre-connected sealed catheter tubing junctions, following physician's orders or per hospital policy. A patient's Foley catheter system should be monitored routinely, which includes evaluating continuing need for an indwelling Foley catheter. The bag should be emptied at regular intervals. Drain the urine into a separate clean collection container for each patient. Do not allow the spigot to touch the sides of the container. Follow hospital policy for emptying the Foley bag prior to transporting a patient. If you need to obtain a urine sample, start by occluding the drainage tubing a minimum of 3 inches below the sample port. When urine is visible under the sample port, swab the surface of the barred Easy Lock sampling port with an antiseptic wipe. Follow the instructions of the antiseptic to ensure optimal result. Position the Luer device over the sample port. Press firmly and twist gently to open the port. The port may also be accessed using a slip-tip syringe. Aspirate the desired volume. If using a syringe, transfer the specimen into a specimen container, label it, and place it in a transport pouch. Send the specimen to the laboratory immediately or refrigerate until transported, following hospital instructions. If using a specimen tube, label the tube and place it in a transport pouch. Follow the hospital specimen handling guidelines. When the patient no longer requires catheterization, remove the catheter in accordance with hospital policy and physician's orders. Remove the StatLock Foley stabilization device or other securement product prior to discontinuing the Foley catheter. Follow the device-specific instructions. You may now remove the Foley catheter. Gently insert a Luer lock or slip-tip syringe in the catheter valve. Never use more force than is required to make the syringe stick in the valve. Allow the pressure within the balloon to force the plunger back and fill the syringe with water. If you notice slow or no deflation, reseat the syringe gently. Use only gentle aspiration to encourage deflation if needed. Vigorous aspiration may collapse the inflation lumen, preventing balloon deflation. all of the water should be removed from the catheter balloon. If the balloon will not deflate, and if permitted by hospital policy, the valve arm may be severed. If this fails, contact adequately trained personnel for assistance, as directed by hospital policy. Should balloon rupture occur, care should be taken to assure that all balloon fragments have been removed from the patient. After the balloon is deflated, remove the catheter and discard it according to hospital policy. Place the Foley catheter bifurcation into the StatLock device retainer. The directional arrow should point towards the catheter tip. The wide channel in the clamp should hold the drainage arm, and the narrow channel should hold the balloon arm. Be sure the bifurcation hits the post in the clamp to seat the device properly. Close the lid by placing your fingers under the pad and pressing the grip markers at the end of the clamp with your thumb, being careful to avoid pinching the catheter. Identify the proper securement site by gently laying the StatLock stabilization device straight on the front of the thigh, then back up 1 inch towards the insertion site. Make sure the patient's leg is fully extended. Follow StatLock stabilization device instructions for use. Cleanse and degrease the securement site with alcohol or per hospital policy. Let skin dry. Apply the provided skin protectant using both pads in direction of hair growth to an area larger than the securement site. Allow to dry completely, approximately 10 to 15 seconds. Using a permanent marker, write your initials and date of application on the StatLock device anchor pad. Align the StatLock stabilization device over the securement site, leaving approximately 1 inch of catheter slack between the insertion site and the StatLock stabilization device retainer. While holding the retainer to keep the pad in place, peel away paper backing, one side at a time, and place tension-free on skin. To remove the StatLock stabilization device, open the retainer by pressing the release button with your thumb, then gently lift to open. Remove the Foley catheter. Stack and fold 5 to 6 alcohol pads and wipe the edge of the pad until a corner lifts. Then continue to wipe the undersurface of the pad in a back and forth motion by squeezing the alcohol out to dissolve the adhesive pad away from the skin. Foley catheters are intended for use in the drainage and/or collection and/or measurement of urine. The most common risk is urinary tract infection. StatLock stabilization device should be monitored daily and replaced when clinically indicated, at least every 7 days. StatLock stabilization devices are contraindicated on patients with known tape or adhesive allergies. Please consult product inserts and labels for indications, contraindications, hazards, warnings, cautions, and directions for use. BARD, EasyLock, StatLock are trademarks and/or registered trademarks of CR Bard Incorporated.